So I'm Dr. Ledwich, and I'm talking about gout today, which is a very common, very prevalent condition that causes a lot of undue pain and suffering for a lot of patients. Gout's been around since the beginning of time. Back in medieval times, it was actually referred to as the rich man's disease because it was typically associated with rich diets, lots of drink, lots of alcohol. What happens with gout is basically you have uric acid in the blood that clumps together and it forms crystals. Those crystals then get into your joint spaces and cause inflammation. When those crystals cause inflammation, that's what leads to redness, irritation, soft tissue swelling, and the pain. It likes to affect small joints, typically in the feet, but it can affect any joint. Sometimes we see it in the hands, the elbow, the knee, but it definitely likes feet and ankles. Colder temperature, decreased blood flow, that's where the crystals, uric acid tends to precipitate out and form the crystals. So in terms of treating gout, you can treat it from three angles. You can treat at the level of inflammation with steroids and NSAIDs, things like Motrin and Indocin. Those work great to calm down the inflammation. The problem is they're a Band-Aid. They stop the attack, but they do nothing to get rid of the uric acid, so you're always at risk for future attacks. Plus, you can have subclinical damage in the joints if the uric acid levels are high. If you go further back in the cycle where the uric acid clumps together and forms crystals, there's a medicine called colchicine, also known as Colcreze or Mitigare, which stops the uric acid from clumping together into crystals. That's also a great treatment for gout. It can prevent attacks from happening. The problem is it, again, does nothing to limit the uric acid level. To really get at the heart of gout, you actually have to lower the uric acid level in the blood. You want to get that level definitely below 6, preferably below 5. We have a lot of problems because a lot of standard labs, when they draw a uric acid level, will list a value of between 7 and 7.6 as normal. There's a push in the rheumatology community for standardized labs to actually lower their reference uric acid level to at least 6, if not 5, because if you have a uric acid level of 7 or 7.2, it's too high. You definitely want it below 6, preferably below 5, to A, stop gout attacks from happening, and B, potentially prevent other complications from high uric acid level. So you attack it three ways: lower the uric acid level, prevent the uric acid from clumping together into crystals, and stopping at the level of inflammation. The best way is to get the uric acid level out of the blood. Okay, so where does uric acid come from? It comes from exogenous sources in diet, specifically consumption of meats and notoriously shellfish. Your things like lobster and shrimp. Meats and shellfish have proteins in them called purines, and purines are the building block to make uric acid. Consumption of certain leafy green vegetables can increase your uric acid level. Consumption of processed foods with a lot of excess sugar and alcohol can also cause decreased release of uric acid and make the levels go higher in your bloodstream. Not getting enough sleep can actually raise your uric acid levels. There's finally some studies that show obstructive sleep apnea is linked to gout attacks. Basically what happens is when you get restorative sleep, your body's in a state of relaxation, you get blood flow or perfusion to organs that need it, including the kidneys. If you're not getting good restorative sleep, the kidneys aren't getting perfused with the blood they need, so it's harder for them to filter the uric acid out of the blood. So in terms of treating your gout from a lifestyle standpoint, again, the things we recommend for almost all other comorbid conditions, decreasing consumption of meats and processed food, increasing consumption of lean meats and vegetables, getting enough sleep, and hydration. Now, and cutting out, limiting alcohol. Now, even making dietary and lifestyle changes alone, it's typical that you only lower the uric acid level by 1 to 2 deciliters. So a lot of times we'll have patients that say, "Doc, I'm doing everything right. I've cut out everything I enjoy and I'm still having gout attacks." What's difficult is even with diet alone, you can only lower the uric acid level 1 to 2 points. So you almost always need to take medicine to treat gout. With that being said, I did have a patient that this person took the uric acid level from around 11 to 5.6 with diet alone, but this person was a complete vegan. So I would never ask a patient to do something I can't do myself. So it is possible with diet alone, but it's extremely, extremely difficult. What I always tell patients is to do the lifestyle and dietary modification in combination with standard treatment, because all the lifestyle changes you make to lower uric acid, they're going to benefit a multitude of other health problems. They're going to benefit if you have high blood pressure. They're going to benefit if you have cardiovascular disease. They're going to benefit if you have diabetes or metabolic syndrome. So even though it may not, get the uric acid level below where it needs to be by diet alone, it's going to help other medical problems associated with gout. So I absolutely push diet and lifestyle changes. In terms of treatment options for gout, the two main ways to lower the uric acid level are by decreasing the production of it or by increasing the excretion of it. It's excreted through the body, through the kidneys. So basically your kidneys filtered out and it's gone out in the urine. So the medicines that target gout either decrease the actual production of uric acid in the blood or they increase your release of it through the kidneys. In terms of lowering it in the blood, there's a class of medicines called xanthine oxidase inhibitors. Allopurinol and Uloric are the two common ones in this class. They both work by stopping conversion of one protein into a building block for uric acid. So that decreases the level. Very, very effective medications. In terms of increasing excretion of the kidneys, or increasing the kidneys' excretion of uric acid, probenecid and lesurinad, also known as Zermampic, are two good medicines for doing that. The problem is if a person has underlying kidney disease, which is a common problem in gout, you may be limited in use of those medicines. And a lot of times they will not get the job done by themselves. You need to use them in combination with Uloric or allopurinol, but that is something that can help increase excretion of uric acid through the kidneys. There is a relatively newer medicine called Krystexxa, which I'll group it under increasing excretion of uric acid. What Krystexxa is, it's an enzyme called uricase. It's found in animals, but we don't as humans produce it, nor do higher primates produce it. It's why your dog never gets gout. So basically, when animals have uric acid in the blood, the uricase will break it down. Krystexxa is basically a synthetic form of uricase that's given by IV infusion, which will break down uric acid in the blood, thus enabling your body to excrete it. So the way, like I said, to reduce uric acid is by decreasing production with a class of medicines, Uloric or allopurinol, or by increasing excretion of it. As I said, in terms of lifestyle changes, hydration, so you're increasing perfusion to the kidneys, getting enough sleep, and obviously limiting consumption of your red meats, especially processed foods, and especially getting enough sleep are all things you can do to help control gout. I'll get a little bit off topic here. The topic's on gout. There's a lot of emerging evidence that high uric acid levels may actually play a role in development of other medical problems too. Until recently, it was thought, okay, if someone has heart disease, diabetes, metabolic syndrome, these patients all have high uric acid levels. The high uric acid was always thought to be a byproduct related to the other diseases. There's some new emerging evidence that high uric acid levels may actually be playing a role in driving other disease processes besides gout. With that being said, we don't have data yet that says put patients on these medicines just simply for lowering uric acid. You only use them to treat gout. Okay. Going through that pretty quickly. Does anybody have any questions so far? Yes. So again, it's risk versus benefit. So leafy green vegetables like your spinach and your kale, they can actually increase uric acid levels. With that being said, they have amazing cardiovascular benefit. They're loaded with antioxidants and they help a multitude of other health problems. So what I always tell patients with gout is in moderation. I personally recommend not completely eliminating them because they have a lot of health benefit. But if you're going to be having, a spinach and kale salad, don't have shrimp on it with a glass of beer.
Great overview.
Thank you.
Very good.
Other questions? Yes, thank you. I forgot to mention that. The exercise is important for the same reason as sleep and hydration. It increases blood flow and perfusion to the kidneys. So when you increase exercise, it increases cardiovascular health, so it'll increase your blood flow to the kidneys and help your body naturally get rid of it. Yes, increasing perfusion.
Okay.
The other thing exercise does is it improves your peripheral circulation, especially to the feet. The reason gout likes to attack the feet is blood flow tends to be less there. It tends to be a colder temperature. If you exercise consistently, you're increasing blood flow to those extremities. It tends to be warmer. Warmer temperatures make the uric acid less likely to clump together and give you those crystals. Okay.
Awesome. Thank you.
Thank you, guys.
Very good talk.
Thanks.
Very good.
Thank you.